other questions are how painful is the hernia surgery. So again, the amount of pain is related to the type of hernia, the size of hernia that you had, the location, and also the technique that I used. So for example, in patients that they have groin hernia, when I do the surgery with a minimally invasive, robotic and laparoscopic, they just have incision pain and they don't complain of groin pain at all. But when we do hernia surgery in the midline of the abdomen and we bring the muscle tightly and close them together, they have significant discomfort in the abdomen after the surgery. So again, the intensity of the pain is really depends on those issues. But majority of patients after 2 to 3 days, they settle down, the pain goes down, and they usually complain of just the soreness, and they don't require that much pain medication. The abdominal binder is very helpful for people who have midline abdominal surgery, and as I said, that decreases the discomfort. It actually gives them a sense of security, that they are always cautious about not doing too much. So the binder is also helpful from that standpoint. It also decreases the swelling as well. The majority of patients, regardless of what type of hernia surgery they have, after 2 weeks, they don't complain of any pain. They don't require pain medications, and they don't take any medicines at all. Now, the last question I'm going to answer is that some of my patients would ask, is the hernia repair permanent? So, yes or no? The hernia repair is permanent if you follow the instruction and everything goes well. Obviously, there are issues that can put you at a higher risk of recurrence, means hernia comes back. For example, if the hernia is massive, like you wait so long and not get the surgery done, and the hernia gradually grows, and obviously the larger the hernia, the risk of recurrence of the hernia is higher. So that's why I recommended always my patients, when they have a smaller hernia, they come in and fix it, even if they don't have symptoms, because that defect never gets better and it just gets larger. So that's one issue. If you have a very large hernia, sometimes they have a higher risk of recurrence. If you're obese and they have patients extremely overweight, and there's a lot of tension and pressure on the incision area, obviously that puts you at a higher risk of hernia recurrence again, so the hernia can come back. So again, that's why we recommend patients who are morbidly obese or extremely overweight to lose weight before they go under hernia surgery, unless it's really emergency. And keeping your weight ideal, always important to prevent recurrence of the hernia. And then also the technique is important too. So when we, for example, fix the hernia in the groin area with the minimally invasive surgery, I place a large mesh in that area that normally there's a weakness, and it covers that area beautifully. But when we do open surgery, sometimes you can close one side of the hernia and there is another weakness in another side next to it, and they can come back again later during their lifetime with another bulge in that region. So the technique is also important as whether the hernia has a higher risk of recurrence or not. I hope this video was helpful for you. I tried to take you through the journey of hernia repair, and I tried to answer the most common questions that the patients of mine had over the last 20 years. I have been operating on a significant number of patients with a hernia, and I gained significant amount of experience throughout this last 20 years, and I would be extremely happy and honored to help you, whether by calling my office directly, or we can even have conversations with the telemedicine equipments that we have, or come to my office directly. Thank you.